dietitian here at GI for Kids, and today we're going to talk about celiac disease.
So what exactly is celiac disease?
Celiac disease is an autoimmune disease that causes your body to react to gluten. Gluten is the glue that's found in wheat, barley, and rye. Take this Play-Doh, for example. The gluten in it helps it to stretch without breaking.
So what types of symptoms do people with celiac disease have?
It can vary, and it's different for everyone. Some of the common symptoms we see are GI symptoms like diarrhea and belly aches, poor growth, headaches, and joint pain. There's hundreds of symptoms though, so it's difficult to know. If you think you may have celiac disease, you should be evaluated by a gastroenterologist before you make any changes in your diet.
So how common is celiac disease? 1 in 100 people have celiac disease. 1 in 10 is the risk of developing celiac if a first-degree relative already has it. 2.5 million people in America are currently suffering from celiac and are undiagnosed. Celiac disease is diagnosed during endoscopy by taking a biopsy of the small intestine. Inside your small intestine, you have finger-like projections called villi that help you absorb nutrients from the food that you eat. People with celiac disease have shortened or blunted villi, making it harder for them to absorb nutrients such as calcium, iron, folate, and vitamin D. It is important to not start a gluten-free diet until after the test has been performed in order to avoid a false negative.
After you are diagnosed with celiac disease, it's important to follow a strict gluten-free diet. The only proven treatment for celiac disease is a 100% lifelong gluten-free diet. It only takes 20 parts per million, which would fit on the end of a pinprick, to cause your intestines to react. By following a strict gluten-free diet, it gives your small intestine time to heal, which makes you feel better. You may be asking yourself, how do we follow a gluten-free diet? That's where Madden comes in.
As I said earlier, gluten is found in wheat, barley, and rye. These proteins are found in a lot of processed foods like breads, baked goods, and sauces. You may see in the grocery store foods that are labeled gluten-free, but this doesn't necessarily mean that they're healthy, and sometimes they aren't even safe for people with celiac disease. However, there are a lot of foods that are naturally gluten-free that you can incorporate into your diet if you have celiac disease.
One of the most difficult aspects of celiac disease is the risk for cross-contamination. Take a fryer with clean oil, for example, and add French fries or potatoes, and you have an okay gluten-free food for them to eat. However, if you take the same fryer with the same clean oil and add foods such as chicken nuggets with breading in it, you now have a fryer with contaminated oil. And if you add the same French fries or potatoes to that oil, you now have a non-gluten-free food that is unsafe for a celiac person to eat. To recap, celiac disease is an autoimmune disease that causes damage to your small intestines when you ingest gluten. Symptoms can vary widely person to person, but often include poor growth, abdominal pain, diarrhea, and headaches. Celiac disease is diagnosed by endoscopy, and dietary changes need to be made after diagnoses. The only proven treatment for celiac disease is a 100% gluten-free diet. If you think your child may have celiac disease or you are in need of dietary counseling, please call GI for Kids and schedule an appointment today.